Welcome, folks. I love seeing all of the new first timers or the folks who have been around for a couple of years and are still seeing it's worthwhile to join. That I think brings us hope. This is my 11th Children's Advocacy Day, and I don't know how long we've been doing the weeks for. But we turned it into a whole week because it creates a lot of opportunity for us to build support around these really critical policy priorities that are good for kids and families in Kentucky. And as you all are well aware, that is the whole purpose of Children's Advocacy Week and Children's Advocacy Day at the Capitol, especially. It creates an opportunity for us to really activate advocates around these policy priorities and kids' issues and be very present and vocal with our state elected officials. Because we hope that you will be advocating and speaking with your legislators like this week and beyond, we want to share the blueprint for Kentucky's children policy priorities with you all and point out the specific policies that already have bills moving or bills that we expect to move this session. You can also find all of this information that we cover today, and we may go fast, so please drop questions in or check out those links that we drop in for the bill tracker or for the fact sheets or the information that is shared related to the specific policy priorities. You can find out more information on the Kentucky Youth Advocates bill tracker, especially, and keep that. I don't know if you want to bookmark it or keep it on your computer during session to check back to see what's moving. We've got these neat little progress bars and links to the bills. It's a great tool to have. Also, again, questions, please put those in the chat. I know for some people, you've been around, you've done this a couple of times. For others, this is brand new. And policy is complicated, and the legislature can be complicated or confusing, especially if you are not as familiar or you're not doing this work every day. So, Mara, I think I'm just going to jump right into the blueprint background, right? And then talk a little bit about session. The Blueprint Coalition, or the Blueprint for Kentucky's Children, started over a decade ago, and it's a coalition of nonprofit, public and private organizations that stands on three key pillars. And those pillars are thriving communities launch strong families launch successful kids, and successful kids launch a prosperous future for Kentucky. And that's really what we hope to see. Again, just as a reminder, and we've said this a couple of times, this is a short session. It's a 30-day session instead of a 60-day session. And it is generally not a budget session. So we anticipate many of the priorities that go through will not have any kind of budget implications. So with that being said, again, drop those questions in the chat if you have them, but I'm going to pass it over to my colleague, Alicia, who is going to get us kicked off on each policy priority.
Great. Thanks so much, Shannon. So I'm going to talk a little bit about a couple of health priorities that we have on the blueprint this year. So this first one that you see is really, I want to go backwards and talk about a win that we had in 2022, which was to extend Medicaid coverage for new mothers for 12 months postpartum, so that mothers are not losing coverage to seek care that they might need in that first year after giving birth. That was a very exciting win, and we were really excited to see some momentum around maternal health. And so this year, we're interested in hoping to kind of build on that momentum and again, focus on maternal health by looking at ways to support new mothers in the weeks and months after welcoming a new baby. So we want to begin with identifying any needs that they might have for increased support during that time. So by ensuring that all new mothers are being assessed for postpartum depression when visiting medical offices after birth, so this includes their own checkups, but also the baby's well check appointments with their pediatrician, we believe we can identify possible symptoms of postpartum depression and help get them connected to any needed resources that they might have. And then within this, we also want to see some changes to ensure that new mothers are receiving materials and education around postpartum depression, what that could look like, the symptoms, and how to seek care. And then something that's related to, again, just those weeks and months after a new baby is welcomed is a priority that we have this year, which is an ask for the General Assembly to approve a study that is focused on developing a paid family leave infrastructure that is best suited for the Commonwealth. So this is a way to support new parents and the workforce by making sure that folks have time off as they are welcoming a new baby. So again, this is just asking for a study to see what this could look like in the future if we were to implement in Kentucky. And then transitioning into another health priority that impacts a lot of young children, but especially our older middle school and high school students specifically a lot, is an effort to reduce the initiation of tobacco use among our youth. So this includes e-cigarettes and vapes. We know that a lot of youth are able to access these products by purchasing them directly from retailers. So when we talk to kids around the state, they talk about how it's pretty easy for them to kind of walk into these stores. And although the legal purchase age is 21, it tends to be that they kind of know where to go to get the products over the counter, right? So if we're able to require retailers to be licensed in order to sell tobacco products, we think we can help to enforce the Tobacco 21 law in a more comprehensive way. So this change would provide data to tell us who is selling these items and where they're located, as well as, like I said, providing that increased enforcement on underage sales. So this priority is really a way to kind of bridge the gap between what we currently have in state law and in federal law, which each of those helps with enforcement of tobacco product sales, but neither of them is able to be comprehensive and cover everything we need to enforce on those retailers. So we just want to make sure that youth are not accessing these from retailers. And again, to stop the initiation of those tobacco products and nicotine products, which they become addicted to. So with that, I am going to turn it over to my colleague to talk a little bit more about some more priorities on the blueprint this year.
Thanks, Alicia. Hey, y'all. My name is Corinna Cash. I'm a policy analyst here at Kentucky Youth Advocates focused on economic security. And wait, I just realized this is actually supposed to go to Crystal, so I'm turning it over to Crystal.
Thanks, Corinna. I'm Crystal Willis, and I work on juvenile justice policy at Kentucky Youth Advocates, and I'm going to go over our juvenile justice priorities for this session. For this session, we know that juvenile justice has been a part of many conversations as of late, and we would truly love to see lawmakers take action and invest what truly works for kids. And they can do that by strengthening our juvenile justice system in ways that prioritize community safety and right-size responses to youth misbehavior, such as implementing an effective continuum of interventions for the system that will hold youth accountable, and also to establish a minimum age of at least 12 years old that a child can be charged with an offense. We really want to focus on ensuring that youth and their families are receiving services that they need, and that we are addressing the root causes of youth misbehavior rather than always using incarceration as a one-size-fits-all approach. And with that, I will turn it back over to Corinna Cash.
Thanks, Crystal. Now I will actually be talking about some of the economic security policy agenda on our blueprint. And the first one I'm going to be talking about is around unemployment benefits for victims of interpersonal violence. Leaving an interpersonal violence situation such as stalking and domestic violence is both extremely difficult and can be extremely dangerous for families and children. Many victims of interpersonal violence report having to miss days of work, leave their jobs, and move in order to escape abuse. This policy would give survivors the time and resources they need to establish a life independently of their abuser by allowing survivors of interpersonal violence to access unemployment insurance when their reason for unemployment is abuse related. This unemployment would come from the state pool, not the employer's pool. And there is actually a bill filed on this already by Representative Kulkarni and Representative Heverin. That is HB 93. The next policy I will be talking about is eviction expungement. Housing stability is something that's absolutely essential for the well-being of Kentucky kids and family, and evictions leave a permanent mark on a family that can make it really hard for them to find safe, stable housing in the future. Even having an eviction filed against you can leave a mark that makes it extremely difficult to find stable housing because of the software that landlords use in order to check tenants. Louisville and Lexington both have an eviction filing rate that is higher than the national average, and nationwide, we know that Black women-led households are evicted at the highest rate. So this policy would create a procedure to automatically expunge evictions after a set number of years and seal eviction filings that don't result in a judgment, giving families that second chance they need to achieve housing stability. And the final thing I'm going to talk about is homeless IDs. Without an ID, it is virtually impossible to achieve housing and economic stability. You need an ID to get housing, to get a job, pick up medication, or enter any type of treatment, and also to apply for public benefits. Because of the transient nature of homelessness, it's extremely difficult for all homeless individuals to get an ID, but we know that unaccompanied homeless youth face additional barriers. In order to get an ID, you need your parents' permission, and many of these unaccompanied minors have little to no relationship with their parents, and they have been kicked out or fleeing some type of abuse. A lot of them have involvement in the child welfare and juvenile justice system. Without having that relationship with their parents, many of these youth are stuck in a dangerous situation, waiting until their 18th birthday to start that life independently of their parents. So this policy would allow unaccompanied youth to get an ID without their parents' permission, and this has also been filed by Representative Randy Bridges as House Bill 21. And now I will be passing it over to Dr. Sarah Vanover.
Hello, I'm Sarah Vanover. I'm a policy and research director with KYA focusing on education. And one of the, although you've heard about a lot about education lately with the teacher shortage and everything we need to do with the workforce, one of the main issues that KYA is looking at on the blueprint this year, again, is corporal punishment. We have many school districts in Kentucky that still allow corporal punishment as a way to utilize discipline in the school system. It's extremely hard to teach children, particularly young children, that physical punishment is not acceptable to hit other people. It's not acceptable to lash out against them if our school systems use that as a way to punish. It also becomes extremely problematic for children who've experienced trauma in their past, elevated to a situation like PTSD almost. We want schools to be safe and nurturing places where children feel encouraged to attend, not that they're worried that they could receive this type of punishment for doing something wrong. So this again is an issue that we want to make sure our legislators understand, that schools have lots of other resources, lots of other ways to redirect students who have recurring behavior problems, but corporal punishment is not the answer to that. So I will pass over to my colleague, Tamara.
Hi everyone, I'm Tamara. I'm a policy analyst at KYA, and the next couple of initiatives I'm going to talk about are relating more to child welfare. So the first one is that we are asking for a program review to ensure the A6 educational programs for youth that are in the care of DCBS or DJJ are accountable and equitable in terms of learning outcomes, finance, and governance. And so if you're not sure what A6 programs, what that means, they're educational programs that exist in residential facilities that typically host youth who are in foster care, or they might have been dual youth in DJJ and in the child welfare system. In 2022, KYA hosted a study regarding residential care experiences in Kentucky, and the results of those experiences were published in a residential foster care report. So in that report, it was documented that the youth who were interviewed did not feel that their education was the same quality as their peers who might be in off-campus schools, so public schools in Kentucky. And specific issues that arose included those youth being in same classes among different grade levels. So they might have had 10th graders in the same classroom learning the same curriculum as 6th graders. They were missing credits between residential schools and public schools needed for graduation. So they may have been in 11th grade in residential school, but when they went back to public school expecting to be a senior, they actually were a freshman. And then a lack of preparation for higher education. So they didn't feel they learned the skills or the knowledge that they needed in order to apply or attend college or other higher education opportunities. And so due to those concerns, we are asking that those programs are evaluated to address that. And the next initiative is to establish an independent ombudsman that provides oversight of the child welfare system by investigating concerns of safety and well-being and identifying systemic issues related to administration or practice and making recommendations for improvements. So the Ombudsman Office at DCBS exists to receive complaints or reports against cabinet staff, and it's currently housed in the Office of the Secretary. And so due to it being internal within that agency, there are concerns of, conflict that reports may not be getting investigated to their full extent. So in order to ensure, that there's less conflict of interest, we need to establish an external ombudsman in an office outside of DCBS to ensure that we're reporting out any trends and issues that need to be addressed on a more systemic level. I believe this goes to Shannon.
Yeah, thanks, Tamara. I'll jump in. Again, I'm Shannon Moody with Kentucky Youth Advocates. So these next two, I just want to warn you, are a little wonky. So if you're not super familiar with the child welfare system, it may take some more thorough definition and or discussion, but please feel free to drop that in the chat if you do want some more information about it. So this first one is really a recommendation for our courts to move to an agency representation model. And basically what that means is that for kids and families that enter the child welfare system, sometimes in most districts, the county attorney's office is the one who goes to represent the Cabinet for Health and Family Services. So they go in, they bring information related to the case on behalf of the cabinet, present the case, and then if it rises to the level of a termination of parental rights, then the cabinet attorney, is the Office of Legal Services, steps in. So this model works and other states use it, but it's really not best practice. And what the American Bar Association and several other organizations recommend is really this agency representation model, where from the very beginning, the agency, the Cabinet for Health and Family Services, has an attorney that is part of the Office of Legal Services be part of that case from the very beginning and represent the agency from the beginning. It's supposed to help with the timeliness to permanency. There's less confusion about roles sometimes between the county attorney's office and attorneys within the Cabinet for Health and Family Services. And it can create some real clarity and continuity if that case does go to termination of parental rights. So again, this is really kind of a procedural change that we're asking for, but what the root of it is that we're really trying to get to better timelines for kids and families so that they are not lingering in care as a result of court slowdowns because of staffing issues or because of confusion around or lack of knowledge around a case. Again, please feel free to drop in the chat if you need anything else on that, and we can discuss more. So the second one that is listed here is something that we've actually talked about for the last couple of sessions, and it has stemmed from a couple of different places. The Cozier Charities Face It Movement policy team has been discussing this because what we know is that the report around alleged or suspected abuse and neglect is most successful and most clear when it comes from the person who gets the disclosure of abuse. So somebody who learns that a child is being abused or identifies the behaviors of a child who may be experiencing abuse and neglect, they are the best reporting source. Now, some organizations and agencies require their staff to communicate that information to the leadership of the organization before it is then reported to the appropriate reporting source, which is fine. We need to keep everyone in the loop. Organizations and agencies should absolutely be involved in that process. However, the agency shouldn't necessarily be the one to report it. The agency head shouldn't be the one to report it if they were not the one to receive the disclosure. So what we're asking here is that we reduce or eliminate the reality of this chain of command, making sure that the person who has the information, the specifics, the details of the alleged abuse and neglect is the one who is directly reporting it. And if the abuse or neglect is occurring as a result of somebody who is employed by one of those reporting sources, whether it's law enforcement, the Cabinet for Health and Family Services, or the county attorney's office, that if the perpetration is being alleged by an employee, it needs to be reported to one of the other reporting agencies rather than reported internally. We saw this in particular with an unfortunate case in the Louisville area with the Explorers program, where the alleged abuse was reported, but it was reported to folks within the same system, and it didn't get communicated where it needed to get communicated so that investigations could take place. We often call this chain of command reporting, but this is an area to just ensure that reporting is happening and it is getting addressed in the way that it needs to be. So I think that is all of the priorities that we have discussed overall. And what I would encourage folks to do is, if you have a question related to any of the priorities, please go ahead and drop those in the chat. I know we went through those relatively quickly. There was a lot of information thrown at you, but if you've got something where you want some more clarity, or you just have a question, whether it's nuanced or not, go ahead and drop that in and we can address it. So Leslie had asked a question about the reason for the current process with the county attorney. I actually don't know why that started. I don't know if it was just a means of staffing, or it felt more feasible within those counties where there are a small number of dependency, neglect, and abuse cases, or maybe there were not enough cabinet attorneys generally, and oftentimes they had to focus on the TPR. So I'm not sure, but best practice tells us, I think, that agency representation model is ideal. So Corinna, there is a question in the chat from Kristen that I think you would be qualified to answer.
Yeah, definitely. Unfortunately, because this year is a short session and we are not touching the state budget, there is nothing related to food insecurity this session. Usually a lot of the policies related to food insecurity require the state budget to be open and for state funds to be invested. So hopefully we will see something next session.
Crystal, I don't know if you can see in the chat, Dr. Cicely Ruff had asked, are there any delinquency prevention efforts in juvenile justice that you think are needed, or areas to focus prevention?
Yeah,
I don't know how, yeah, go for it.
That's a great question. I appreciate you asking that. One thing that I've learned from working with young adults with actual lived justice experience or justice system experience is that kids need things to do, and this is a part of that prevention measure. A lot of the youth have identified community centers being one of those huge opportunities where youth feel like they can be a part of their community and they feel like they have a safe space to just be themselves and be able to interact with their peers. And so without some of those proactive things to do, this gives youth opportunities to get in trouble. And so a lot of what we want to focus on is prevention measures, and also focusing on some of those early intervention measures when youth first get in trouble, and providing them community-based alternatives rather than just sending them through the system. Did that answer your question, or any follow-up questions?
Mara, is it okay to ask a question before we transition to, okay. Does anyone have any meetings scheduled with their legislators tomorrow or in the coming weeks to talk about priorities, whether they're on the blueprint or not? I see a yes. All right. That's good news.
And if you're interested, I keep dropping in the chat there the link to the blueprint page where you can find fact sheets on each of these. So you are welcome to use those as a resource as you go into those legislator meetings. either in person, or if you're reaching out to your legislators this week, drop them, a couple of those fact sheets to be like, hey, I'm interested in this and what it could mean for kids, and pass that along to them. So we have those dropped there in the chat, as well as the legislator lookup tool. So if you're not sure who represents you in Frankfort, your representative and senator can use that tool to look it up and find their contact info. Looks like we have one more question that was just dropped in.
Yeah, Melissa, I would agree with you. The recommendation is really to ensure it's clear in the language that agencies are adhering to that clearly. So while you're understanding that complying with chain of command reporting is optional for the reporter making that report, it's still happening in systems, especially large organizations, and sometimes in systems that serve kids broadly. So I think what we are hoping to do is just further clarify that. So it's really clear that that should not be happening, and agencies should not be creating that organizational policy.
All right. If there's no other questions, we appreciate your thoughtful questions and diving deeper into the blueprint with us today. I know we have just a couple kind of wrap up, take action items. I know I've dropped in lots of things in the chat for you all, but just some, reminders. Obviously, there's, our big rally day at the Capitol tomorrow. So if you need any details on that, and some of the events happening the rest of the week, be sure to check out the Children's Advocacy Week webpage on our website. Check out that blueprint website to be able to find those fact sheets and a link to the bill tracker. Like our team here said today, we will continue to be updating that. So right now we just have, there's 2 bills that have been filed, but there's a few more that have been filed here that are planning to be filed this week. So we'll be continuing to update that. So like Shannon said, pin that if you're interested so you can see how that is progressing. And when there's opportunities to take action, we'll be putting that within the bill tracker for you to kind of know what the ask is, to be able to follow up with your legislator specifically, as well as on our social media channels. So be sure to follow KYA on, we're on Facebook, Instagram, and Twitter. And when you use those hashtags, you can kind of follow along closely with what's happening in the session with these blueprint priorities. And of course, our Children's Advocacy Week hashtag there. So you can kind of see what folks are doing throughout this week, which we're really excited to see so many folks engaged with. So before we close out here, I just wanted to give a final thank you to our Children's Advocacy Week sponsors, including Aetna and 7 counties and Save the Children, who are our signature and presenting sponsors this week. And we hope you all make the most of tomorrow if you're able to join us in person. If not, to tune in on Facebook Live as we stream the rally at 10 a.m. on KYA's Facebook page. And it's a prime opportunity tomorrow to be sending an email to your legislators to let them know that you want them to prioritize kids this session. So we appreciate each of you, and we hope to see you soon. Thank you all.
Thanks, everyone.